Hello everyone, my name is WANG HAOYU. Welcome to my emergency assistance campaign. Today I will introduce and demonstrate 3 very important first aid techniques that can be used during emergencies or sports injuries. These 3 techniques are doctor's ABCD, toe taps, and razor. These 3 techniques can wisely used by first aid providers, coaches, teachers, and also healthcare professionals to assess emergencies and provide immediate assistance before professional help arrives. Today, I will also teach 3 of my friends from different faculty and help them understand how to perform these 3 techniques correctly. So by the end of this session, participants should be able to recognize the emergency situation and also know how to assess sports injuries or provide basic first aid safely and effectively. Hello everyone, my name is WANG HAOYU and welcome to my emergency assessment campaign. Today we will learn some important first aid techniques. There are doctor's ABCD, toe taps, and razor. So here are 3 of my friends. They're from different faculty. And today they will accompany me to process today's video. And let's first start with the participant introduction.
Hello everyone, my name is Hu Wang. I'm from FEP.
Hello everyone, my name is Chen Shujun. I'm from FSSK.
Hi everyone, my name is Dai Fengfei. I also come from FEP.
Okay, so first of all, let us begin with doctor's ABCD. Doctor's ABCD is a systematic emergency action plan used when someone is unconscious or unresponsive. So it helps rescuers assess the situation and let them determine what actions should be taken when we meet some person with unconscious or what should be taken before emergency services arrive. So the doctor's ABCD stand for D, danger. Doctors R, response, and S, stand for help. A, airway, B, breathing, C, CPR, and D, defibrillation. Okay, so imagine that this person is suddenly collapsed. So the first step is danger. I should check around the surrounding, ensure that there's no hazards that will harm either the victim or myself. So I check the surrounding environment. I think right now this appears safe. So next is about our response. Hello, can you hear me? Can you open your eyes? Are you okay? So obviously the victim is unresponsive. So now we come to the next step. Because the victim is unresponsive, so next step we should send for help. Sir, please call 999
My God.
right now.
Okay.
Tell them we have a victim that unresponsive.
Okay.
Okay, so next step is airway. I open the airway by using head tilt chin lift technique, and this will help prevent the tongue from blocking the airway. And next is breathing. I will check the breathing by looking, hearing, and feeling. So I look the chest movement and listening to breathing sound, and I feel the air flow. So I think the victim now is unconscious. So next step is CPR immediately. Because the victim is unconscious, we will start use CPR immediately. So pretend this is victim. I will teach you how to use CPR step by step. So first, you put your head in the center of the chest and use your another hand on it. Like this, let your arm keep straight and compress the chest at the rate of 100 to 120 compression per minute. And recommended depth is approximately 5 to 6 centimeters. So we start 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, after the CPR, so if the automatic external defibrillator or AED is available, we should use it right now and open it, follow the voice instruction, and attach the pads as shown in the chest here and another here to let the AED to analyze the heart attack. And attention, never touch the victim during the AED rhythm analyze. And after use AED, we can still use CPR again and again until the victim is wake up or the emergency services arrive. Now I will let my friends to demonstrate the first 3 steps of doctor's ABCD. We start? Okay. The first one is danger. I must to look surroundings and check whether it is safe for me and the victim. And the next step is response. Hey, are you okay? Can you hear me? How do you feel? Hey. And the next step is send for help. Hello, can anyone help? Can you help me call for 999? Okay, I will call 999 right now. Thank you. Excellent. So I think this is a very good demonstrate, but remember, keep yourself safe first before you're helping others. Okay, so next we will learn toe taps. Toe taps is a sports injury assessment tool commonly used by coaches and first aid providers. It allows us to determine whether an athlete can continue practicing safely. Toe taps stand for talk, observe, touch, active movement, passive movement, and skills test. Hey, my ankle. Oh my god. What's wrong? Are you okay? I don't think so. Okay, so this is a good example for us to show the toe taps for you. So let's first with talk. Can you describe your pain? I think it's outside on my ankle. Okay, so on a scale of from 1 to 10, how painful is it? Maybe 7 out of 10. Okay, can you keep running or? No, I don't really think so. So at this stage, we gather the information of injury and athlete's symptoms. So now I will observe the injury. So now I will observe the injured area. I can see some swelling around the ankle, but there is no obvious deformity. Can you see any bruising? No. So now I will gently move your ankle for you. So if you feel pain, please tell me, okay? Hey, that hurts. So I think the injury presents in the lateral of ankle. So now can you move your ankle by yourself? Yeah, I can move it, but it still feels a little bit pain. Good. So this shows active movement is possible but restricted. So now I will move your body, move your ankle slowly. Hey, that's really painful. So the passive, when we do the passive movement, victim feel pain is increases. So now let's do some skills test. Okay, so next we will do some skills test. Please stand up carefully. Okay. And walk slowly. Can you jump? No, it will hurt much. So determine these victims. So we think the victim cannot do some normal movement. At this time, we should stop all the activities immediately and take some some injury management at this moment. So the appropriate method is riser. Okay, because injury appears significant, so we now use riser management. Can you still exercise? No. So the first step is rest. Please sit down. Rest can prevent the further damage to the injured tissue. So how are you feeling now? It's still painful and swallow. Okay, so now we use the ice bag. Ice can prevent the further damage and reduce the swelling and pain. But remember, always use a towel wrap the ice bag. you cannot use the ice bag directly touch the victim's skin. That's very important. Okay. Okay, so I will use ice bag for you. This is a swollen. This is a toe.
Yeah,
I feel better now.
yeah, I feel more comfortable.
So now we begin the compression. We use the bandage.
This one also feels a little bit better.
Is the bandage should feel firm but not too tight. Poor circulation will occur if the bandage applied too tightly. So I feel now, right now?
Yeah, I feel it's a little bit better.
Okay, after we use the compression, we need the elevation. Place your leg in this toy. Are you feel better now?
Yeah, I feel much better.
So if the swelling and pain continue after 24 or 48 hours, refer to a healthcare professional is recommended.
Oh, so if I still feel pain, I need to go to see the doctor, right?
Exactly. Persistent symptoms should always be assessed professionally. Okay, that's all for the razor. Now I would like my friends to show the correct razor action.
Are you okay? Not really. Please sit down.
Oh, stop.
It really hurts.
So here is a mistake. Can anyone tell me what is wrong?
Oh, the ice should not be placed directly on the skin.
Correct. Ice must always be wrapped in a towel. Otherwise, skin damage may occur. Excellent observation. Okay, continue please.
Hey, it's still painful.
Good. This is another mistake. So compression should be firm but not excessively tight. Too much pressure may reduce blood circulation.
Yeah, now it feels much better. How long? Thank you.
Okay, good. Okay, so that's all for our today first aid technique education and demonstration. So make sure my friends can understand all of these first aid techniques very well. We will have some quizzes for them. Now let's start the quizzes. Okay, so now we will start the quizzes. Let us check what the participants have learned today. So question 1, what does D stand for in doctor's ABCD?
Dangerous.
Okay, so question 2, why is CPR important?
Because CPR could help maintain the blood circulation and oxygen supply when a person couldn't breathe normally.
Very good. Okay, question 3, what does the letter I represent in riser?
Ice.
What is the first step of toe taps?
Talk.
Excellent. Okay, so all participants have demonstrated a good understanding of these techniques. Are you learn today?
Yes.
Learn new things?
Yes.
Okay, thank you. Okay, that's all for our today's demonstration. Today we learned 3 very important first aid techniques: doctor's ABCD, toe taps, and razor. These methods can help you respond safely and effectively during emergencies and sports injuries. Although first aid cannot replace the professional medical treatment, it can significantly improve outcomes and potentially save lives. I hope this campaign can increase the awareness and confidence in providing emergency assistance. Thank you to all participants for your cooperation, and thank you everyone for watching. I hope you have a great day. Bye bye.